This is indwelling catheterization. I am in my patient's room. I do some hand hygiene. I make sure that I have the right patient. I ask the patient to identify themselves, so name and date of birth. I educate my patient on what I'm going to do, which is an indwelling catheter. I ask my patient about allergies, especially to iodine and latex, which are both used in this procedure, and I make sure that a catheter is actually sensible in the first place, and that it's in the chart, which I probably said before, but just in case, that it's in the chart. So if everything is in the chart and the patient is not allergic to iodine or latex and the procedure is appropriate and the right patient, then I put on clean gloves, I do pericare, I take off the gloves, I hand hygiene again, and I get ready to set up my sterile field for the procedure. My sterile field. These are my sterile gloves. This goes under the patient with this shiny side facing down. Ask the patient to lift up her bum and put it under the perineum. This fenestrated drape is the same thing. And I put it over the patient, leaving the perineum in view. Now I put on my sterile gloves. I'm going to want to move on. Are you? And the waist. Okay. This is my kit. I have these swab sticks that I'm going to use to be cleaning the patient. There are 3 of them. I have this lubricant, which I'm going to use to lubricate the first 1 or 2 inches of the catheter. I'm not going to open it because we don't have enough. This syringe I'm going to attach to the catheter itself when it comes time to do that. And this is the catheter. This. I'm going to lubricate the first 1 or 2 inches of the catheter. And then put that back in here. And go and see my patient now that I have my thing set up. Now I am in my patient's room. I'm going to be contaminating my non-dominant hand by using it to spread the labia with thumb and forefinger, since I have a female patient. I'm going to use one swab to clean from the top to the bottom on one side of the meatus, then on the other side, and then right down the center. Now, I take the catheter, which has been lubricated, and I insert the catheter about 2 to 3 inches until I see urine return, and then advance it another 2 to 3 inches. Once I've done that, I hold it at the meatus and I inject the saline into the balloon. Then I give a gentle tug to make sure it's in place, which it is. I'm going to put this syringe in the sharps container. Going to move this. I'm going to clear out this material. So, dispose of it. Take off my gloves. Dispose of those. Then I'm going to take this catheter bag, and first I'm going to attach the catheter itself to the patient's leg, leaving a little slack. I'm going to hang the bag on the patient's bed, a level lower than their bladder, and then I will help reposition the patient into a comfortable position, put the bed in the lowest position, make sure it's locked, go over to hand hygiene, and record the process.